topic for today is Medicare and where we're headed and what it means for you and your patients. Today in Washington, D.C., the Obama administration is preparing to release its federal budget proposal tomorrow that will have changes proposed for the Medicare program. You might think, well, I'm not over 65, although some in the room may be over 65. What does Medicare have to do with me? In fact, Medicare has a role in the lives of all of us, including residents. The President's proposal will be yet another ongoing salvo in the debate over the future of Medicare. Both Democrats and Republicans have proposed raising Medicare's eligibility age from 65 to 67. Others have proposed that seniors buy into the health exchanges that will be coming online during the health care reform. And others have proposed eliminating fee-for-service medicine in Medicare entirely and having everyone enroll in a private insurance plan. These are proposals on the table, hotly debated. I wrote the book Medicare Meltdown to help the public understand what's going on behind the scenes, the debates that don't show up in the mainstream media. Here's why Medicare matters. There's 50 million people who are covered by Medicare for their health insurance today. This hospital and every hospital depends on Medicare for a substantial portion of its revenues. For those of you who are residents in training, you may not know that Medicare pays your residency stipends. It pays for faculty salaries. It makes residency training possible. All of us pay for Medicare, and we'll all be covered by it, so it's something that we all have in common in the United States. Here's a graph from the Congressional Budget Office from a couple of years ago, 2007, that projected using historical trends in Medicare spending. Where are we headed? In 1996, about 2.5% of our gross domestic product was spent just on Medicare. And if those historical trends continue, by 2082 we'll be spending 25% of the country's GDP just on Medicare. From that same Congressional Budget Office report, and by the way, these graphs were tucked away in an appendix on the last page and haven't seen much light of day, but I think it's important for the public to know this. For total health care spending, if historical trends continue, by 2082 as a country we'll be spending 99% of our GDP just on health care. And so this is why there's urgency around Medicare and health care to find some mechanism to limit how much we spend. And that's the purpose of the book Medicare Meltdown. And it focuses on the business aspects of Medicare, because not only is Medicare an entitlement for seniors, it is also big business. And that's a powerful force driving the trajectory of health care and the kinds of care that patients receive. In that respect, it shines a light on aspects of Medicare that we don't read much about. In fact, more of the news that I read now is on Bloomberg News and other business news to find out what's happening in health care. The book examines where the money comes from to pay for Medicare, where it goes, who's getting it, and what they're doing with it. And I believe that the public has a right to this information because we're all paying for it from our paychecks, and for those who are on Medicare from the premiums that they pay. And once again, we look at the outsized influence of the healthcare industry on Medicare. It is indeed an entitlement for seniors. It's also the largest federal entitlement-based industry in the United States. Let's talk about the size of Medicare. If Medicare were a country, it would be the 20th largest economy in the world. It's enormous. Medicare spends $560 billion in 2011 for 50 million people. And this dollar amount is more than the size of Sweden's economy and double the size of Ireland's economy. Just Medicare as one portion of health care. So no matter whether Democrats or Republicans prevail in shaping Medicare's future, it turns out Medicare will become very crowded by 2030. Every day, 10,000 boomers sign up for Medicare, and 33 million more people will be on Medicare by 2030. This number is equivalent to adding the current combined populations of Austria, Hong Kong, Israel, and Switzerland to the Medicare program. Hospitals, doctors, nurses, and the entire delivery system are and will be under increasing pressure to take care of everyone. And are we ready for it? Medicare pays for residency training, pays for almost all of it. It pays the cost of your stipends. It pays for teaching physician salaries and other expenses. And with pressure on the federal debt, graduate medical education is certainly under the budget microscope, like many other things. Your residency training is funded by $9.5 million in funding from Medicare, $5.8 billion from Medicaid. That's a combination of state and federal money. And once again, it's being closely scrutinized. I'd like to do three things this morning. Identify where the money from Medicare goes and how it's being used. Second, discuss the impact of the incentives in the program and what it means for patients and their physicians, meaning many of you. And I'd like to make the case for limits on Medicare spending to sustain this program for current and future generations. For those of you who are young people in this room, you want to count on Medicare and ensure that it's there for you. So first, where does Medicare's money come from, and how is it being used? In 1965, Medicare laid the foundation for the establishment and growth of the healthcare industry. And the past 50 years have seen an explosion in biomedical advances, dramatic innovation in therapies and surgical procedures, and tremendous successes in the management of diseases that were once fatal. And Medicare has also changed the U.S. economy in unprecedented ways. Here's two graphs on international spending on healthcare from 1980 to 2007. And I'll just direct your attention to the graph on the right. These are total health expenditures as a percentage of GDP for a number of developed countries. And you'll see that the United States, it's the black line, is way out ahead of all the other countries. But once again, this has enabled innovation and the application of wonderful healthcare services to millions of Americans who've benefited. Who pays for Medicare? It turns out we all pay for Medicare. All of us who work pay for Medicare from a 2.9% payroll tax deducted from your paychecks. If you look at your pay stub, you'll see this amount deducted every paycheck. You also pay for Medicare from your federal income tax that you pay. And seniors over 65 pay premiums and co-payments. This was a reader comment to the New York Times in response to a column written by Paul Krugman. The reader wrote, "In my opinion, federal programs such as Medicare that are supported by participants' insurance premiums and not by federal general tax revenues should not be a political football in Congress. While these programs need to be reviewed for their future sustainability, they have not contributed to the federal debt." In fact, that's a myth. Here's the truth. 44% of Medicare spending is paid for by federal income tax revenue. So Medicare does contribute to the federal debt because the federal government does not collect sufficient money from the taxes and other sources to pay all of its Medicare bills and has to borrow money and pays interest on that debt. So yes, Medicare does add to the federal debt. This means that when bills are sent to Medicare, the federal government doesn't have the money to pay all of them, and it borrows money from places like China. And the U.S. federal debt exceeds $16 trillion, and that's an enormous sum of money and growing. Most people think of Medicare as an entitlement for seniors, and it is. But Medicare is also big business. Healthcare businesses and facilities rely on Medicare for $560 billion in annual revenue, the amount that Medicare spends in a year. In 1965, there were no healthcare companies listed on the Fortune 100 list. Today, there are 15 healthcare companies that are on that list and are dependent on Medicare and other sources of funding for their revenue. And these interests have a powerful influence on the debate over the future of Medicare. There's a debate, for example, over whether Medicare should be privatized to move from fee-for-service to private health insurance plans. Already, Medicare is partially privatized. Most people don't know that. 25% of seniors, perhaps some people in this room, belong to a private health insurance plan for their Medicare coverage. In Medicare Meltdown, I predict that this trend will continue. Health insurance companies certainly want as customers as many as they can, and certainly the 33 million new baby boomers who will be enrolling in Medicare between now and 2030. Let's talk a little bit about Medicare waste. The Institute of Medicine of the National Academy of Sciences estimated last September that 30% of all health